Good morning, everyone. This is Saman Sheikh, and it is presented by Anam and me. Today's topic for the presentation is polycystic ovarian disease. So, we'll first cover what is polycystic ovarian disease. So, as I would like to give you an introduction. We all are aware about what polycystic ovarian syndrome is, but I'll still explain. It is a condition which affects women's hormone levels, and it is said like every 10 in one woman is said to be affected by this. Women are they. It is usually said they have increased level of male hormones such as testosterone and androgen, so this hormonal imbalance causes them to skip their menstrual periods, and it causes most of complications, like it is very hard for them in order to conceive. And related to this, they also have more facial hairs and many such underlying conditions. So it is a common condition in women of all lactating age during their fertile years. Other symptoms, as I already explained, they have abnormal hair growth on face and body. They also tend to have baldness, and they are almost high in weight. And it's pretty difficult for them to lose weight. They tend to miss their periods also. They have acne problems, hair loss, uh, and many such underlying conditions. So what are its causes and treatment? Most women in PCOD, it is said, into their ovaries. Like if you are normal and you are not diagnosed with PCOS, you have normal ovaries. But if you are affected with PCOD, your ovaries are said to have small cysts which are not harmful, but these usually leads to hormone imbalance, which can cause you mood swings. There could be certain hair loss, facial hairs, and all such things. So due to this, the cysts, they just grow and they clump it up together, in which, due to this problem, they do not let whatever the cycle is in women's, so they do not let an egg to release every month. Due to this they tend to gain weight, and there are certain hormonal imbalances, and usually people recommend them to just have a normal birth pill, so that it might affect you, but it is not good for a long run. So there are some key treatments for this is main is lifestyle changes. You need to regularly exercise, healthy foods, and weight control. This treatment, it can reduce unpleasant symptoms, and it can help prevent long term health. So if you change your lifestyle, if you stay more active, you exercise more, and have a good diet following, then it probably could be reversed back. So doctors usually prescribe infertility medicines. So going ahead, what is diet and PCOS? So research has shown that healthy eating habits and regular physical activity, it helps to manage PCOS. But focusing on whole grain fruits, vegetables, lean protein foods, and low fat and mostly dairy free products help to manage body weight and body sugar. So PCOD is usually said to be linked to diabetes and thyroid, because it usually creates insulin resistance in your body. So as you go ahead with it, you have higher chances of being diabetic. There are many research which shows diabetes and PCOD linkage. So they are usually recommended metformin, but which is not good in the long run. So it's better you reverse your PCOS than going on to some medications for lifetime. Nutritional management. What is nutritional management? So it defines. We'll discuss about the nutrition and PCOS factor. So it defines PCOS as an endocrine disorder in women of reproductive age. It leads to reproductive and hormonal and metabolic abnormalities. This is due to presence of insulin resistance. Such people do not have good insulin absorption. It increases. There is higher chances of getting type 2 diabetes, hypertension, lipid disorders, cardiovascular diseases, and many such malignancies, such as they tend to have also some women with PCOS tend to have endometrial cancer and stuff. So there are also other environmental factors such as dietary habits, which play an important role in prevention and treatment of this syndrome. There are also certain lifestyle modifications, and they are the most important. Lifestyle modification are most important therapeutic strategies. So the approach to diet therapy, if you have been suggested, a diet, usually it could be cured by having different diets, but it must be specific goal related. It should be such as improving insulin resistance, improving resistance, metabolic and reproductive functions, This can be made possible. It can be made possible through designing low calorie diet. It would also help in weight management. It should limit the intake of simple sugars and refined carbohydrates. Should also intake foods with low glycemic index, reduce saturated and trans fat acids. Attention should be given mostly to possible deficiencies such as vitamin D, chromium, and omega 3. The symptoms of insulin resistance. Even if these people have good diet and good habits, they tend to have fatigue. They usually feel weakness or tiredness. They cannot have so much even after working little, they feel they are too tired. This is due to this is due to this underlying condition. They have cravings for sweet and salty foods, and also have different types of there are also some skin disorders which could be caused due to PCOD. Like they might have some darker patches or more of hairs over the over the lip area. So there are certain problems. So what is nutritional management? Nutritional management, it is basically defined as uh, what should be taken care of if you are following the nutrition in case of a PCOS. It is to define PCOS, it is defined as an endocrine disorder in women of reproductive age, which I already explained you, which has certain abnormalities. So oh my god, this is repeat. Okay, I'm sorry. So let's go ahead. So the approach of diet therapy, it must be as specific goals such as to improve insulin resistance, metabolic and reproductive factors. It can be made possible through designing low calorie diet, which would help in weight management. Usually they are said to have to take care of their weight management and limit intake of simple sugars and refined carbohydrates. This is done. So the best PCOS diet. So people with PCOS are usually recommended to go dairy free and gluten free. So dairy can increase estrogen and inflammation in the body, which could further lead to elevating symptoms of PCOS. And gluten, it can also increase inflammation. And gluten is usually considered not good for body, which usually have PCOD and are mostly diabetic. So they are recommended to have gluten free diet. So lean protein, which may not help in increasing their sugar levels, because if their sugar level rises, they usually might become diabetic. They should consume less sugar, as less as possible. They can go totally sugarless as well, because sugar is anyways not good for body. So they should have more diet which helps in fiber, which would help in increasing fiber diet. Helps in regulating hormone and blood sugar. So they can eat more and more of they can eat more fiber related foods, uh, such so it might contain such as broccoli, and also such as which would also peas. It also consists of many such other vegetables and fruits, which could help in inositol. Usually nowadays, whatever research has been going on, people are focusing more and more on inositol, because it could help in improving insulin resistance. It's found to help in regaining back fertility in PCOS, and it is given in certain doses, and you can mix it with water and have it, or you can also mix it with your food, which has helped a lot of women in overcoming PCOS disease, and it also helps in reducing weight loss, which I've read in certain articles. So, what are dietary and nutrition interventions? So, we basically had we uh, did four articles review. So, what we found out is there was a study done dietary and nutrition interventions, in which what the result found out was that fat should be restricted to at least less than or equal to 30% of total calories. There should be high intake of low glycemic index carbohydrate, which further does not contribute to dyslipidemia and weight gain, and also stimulates hunger and carbohydrate craving. So diet and exercise, it is not it is not that you just recommend one diet and exercise to all people. It should be tailored to individual needs according to their body weight, their preferences, their medications, and all such. So calorie intake is distributed. Calorie intake is distributed between several meals per day, with low intake from snacks and drinks. There should be use of certain drugs to improve insulin sensitivity or promote weight loss. It is a short-term measure, but is usually said to be beneficial in the long term with diet as well as exercise. What is the dietary composition and treatment? So menstrual regularity for a low glycemic, there should be, if you are following any certain diets, it should be looked upon that you have your menses come each and every month. Then only it could be said you have overcome PCS somewhere. Increased free androgen index for high carb diet, then there should be greater reduction in fibrinogen and high density lipoprotein cholesterol, or low carbs and low GI diet. You should have good mood, self-esteem, improved depression for a high protein diet. So results were, there were subtle differences of weight loss with the MUFA enriched diet. But what is dietary management and exercise? So we'll come over. So this is the third article in which there were also certain study done which has to be influence of dietary management and physical activity on ovarian function and ovulation. How does it affect, and how metabolic parameters in it affected? There was randomized 4-month trial, and the result was found to be, on average, BMI is reduced up to 6% by dietary management, and 3% by exercise, and 5% by combined interventions. There are lower body fat and lean body mass were significantly decreased in dietary groups. Upper body fat was lowered and lean body mass was maintained by exercise only. Menstrual pattern, which was usually very poor, tend to improve in 69%, and ovulation was said to be confirmed in 34% of patients. Predictor of resumed ovulation was high serum level of insulin like growth factor, binding protein, and after intervention. So the conclusion is basically whatever the four articles we subsided on. There were subtle differences in different diets which we chose. There was a greater weight loss for a MUFA enriched diet, with a MUFA enriched diet, and weight loss improved the presentation of PCOS regardless of its dietary composition. Such as I said, we could do dietary changes. You could go gluten free, you should go dairy free, or you could also have a MUFA enriched diet in which it tends to basically improve your conditions and will make you normally fertile, and you could have your menses regularly. So weight loss should be targeted in all overweight women with PCOS are regardless of dietary composition. So they should be on reduced calorie intake and setting an adequate nutrient intake and healthy food choices, mostly have, which is dairy free and gluten free. You could substitute, such as you could go for almond milk, or you could go on totally low fat milk, which would even give you the calories and nutrients, as well as it could also help you in the weight loss. Dietary management and exercise, even though I know it's pretty hard with PCOD to reduce weight, but both in combination can effectively improve in reproductive function in obese women with PCOS. There are also underlying mechanisms appear to improve enhanced insulin sensitivity, and this exerts long-term beneficial effects, is what we found out among all the 4 peer-reviewed articles we searched upon. These are the references, and thank you so much for listening to my presentation, and hope I did a better job. Waiting for your comments. Thank you.